My name is Zachariah Scott, and I'm here to talk about my capstone experience and what I've learned. I started with the background. I actually come with quite a bit of background, being in the military for a decade as a medic, also working as a CNA and an EMT for the last 5 years. Um, so there isn't a lot that I haven't experienced so far. So coming into this capstone project, I really didn't have a lot of nervousness, but more of a curiosity for what I was going to see throughout this clinical site. I did my capstone clinical at Vernon Memorial Healthcare in the operating room. I was pretty curious and excited to see what kind of interprofessional teams that were going to be there and how they interacted with one another. Oh, my transition experience was pretty exciting. I was very happy with what happened. I did see a lot of the values come out that we hold in the nursing profession, especially in autonomy and human dignity. I was very impressed. The CRNAs, they were huge patient advocates. They really relied on their nursing background and advocating for the patients. They were always trying to keep them warm. They were always trying to um, use the least amount of medication as possible. They were always looking at how the outcomes were going to be um, for the patients. They always respected the human dignity. They kept as much of them covered as possible. And I was really impressed with the whole team really backing up the CRNA with that as well. There really wasn't any argument between them, as I've seen in other operating rooms that I've had the pleasure of being in clinical in as well. They all shared evidence based practice together, which I was very impressed with as well. And usually, you'd think they're going to argue about stuff, especially with like the surgeon and the CRNAs or the surgeon and the nurses. But if anybody brought up best practice or current research, everybody listened pretty intently and they decided together if they were going to try it or not. And it was all very central around the patient and the best outcome for them. I was very impressed. Um, I also saw between the nurses that graduated from, let's say, a turbo or a 4 year program versus the nurses that graduated with a associate degree, um, there was a lot of similarities, but I did see with the Viterbo graduates in particular stand out with their Franciscan values, and that was very nice to see. And it's something I look forward to continuing on with my nursing practice as I get out in the real world and practice nursing. That was part of my goals as well. And I think I attained my goals during this capstone experience. When I first got there, I didn't really know what I was going to expect, um, and if I was going to meet the goals that I had. But I think I did. My first goal was to have more holistic care in my practice. I come with a background of medic and EMT, and it's very problem focused. You see a problem or a symptom, and you try to relieve that problem or symptom with a patient. And nursing, it's a huge scope different when you look at the whole being. You look at how are they spiritually, how are they emotionally, how are the systems affecting one another. And I learned a lot during this capstone process of how that can affect patient outcomes. And I really look forward to continuing that in my nursing practice. I also, one of my goals was to learn and participate effectively in the interdisciplinary teams. And I did that by building trust and proving myself. Nursing can be a very dog eat dog, throw them to the wolves kind of thing, especially with new nurses. And I didn't really see a whole lot of that in my capstone experience, and it was very enlightening to see that people were taking my point of view as well into consideration. And At first, it was a little skeptic, especially with like the scrub techs. They didn't know if they could trust me or not with sterile technique. So I just did what I was told and proved myself. And by the end of my capstone experience, I was opening up all the instruments and gloves and passing it into the sterile field. And I really enjoyed it. And I think, um, especially in the future when they have students, they're going to be a little more trusting as well, right off the bat. My other goal was to develop more of my leadership plan. What do I expect myself in my future practice? What do I think is going to work best? And from my past experiences as well as this capstone experience, I really feel that leading by example and just getting in there, getting to work, doing the right thing, advocating for patients is really my best leadership style. And I'm excited to continue that into my future nursing practice. Um, my thoughts going through this capstone, with previous clinical experiences, I have seen a lot of new nurses taking on the students, and the new nurses are still learning some of the procedures themselves. And so the new nurses are quite reluctant to allow students to participate and provide care for patients. With this capstone experience, the preceptor I had was amazing. It was a great experience. She did not hesitate at all to get me into the mix, into the procedures, into doing the nursing practice. Um, by week 2 of my capstone experience, I was doing full circulator nurse job in the OR. It was a lot of fun. I really enjoyed it. Everybody in the interdisciplinary team was very excited to help me join in and let me ask questions, and they would ask questions of me to test my knowledge, and it was a really good experience. I'm excited to continue now, with the new knowledge that I have gained, and provide better care than I have previously. And I want to continue to further my education and further my evidence-based practice and further build my relationships and my leadership style to really provide the best care I possibly can. I really enjoyed this capstone experience, and I hope it continues on just like this for future nursing students to really enjoy as well. Thank you very much and have a great day.